Hello dear patients, today we are going to review the topic of blisters on penis. A young man came to us and blisters developed on his penis. There was quite a strong burning, even tenderness in the area of blisters. This was also accompanied by some increase of temperature. On observation we see grouped blisters with a slightly red base. Initially, this picture didn't correlate much with the fact that patient had some temperature. The growth was not so red, but there were quite a lot of blisters on a limited area of penis skin. So, PCR analyses were taken from the surface of rashes for different types of herpes. These are first, second and herpes zoster. As a result of that, a positive analysis for herpes zoster was acquired, which is quite rare, but it correlated with an increase of temperature and to relatively high tenderness that was observed in this patient. This case was quite unusual, as herpes zoster induces an isolated lesion of penis relatively infrequently. This is usually accompanied by lesion of skin integuments. You can watch a separate video about lesion of skin integuments by herpes zoster. However, in this case, an isolated lesion of penis was observed, and we have observed it before. Often dermatologists in clinics or in dermatovenerologic dispensaries try to set such diagnoses by a rule of thumb, and this leads to incorrect dosage of medications. On an example of Valvir, if usually 1 gram per day is needed, then in this case 3 grams are required. That is 3 times more than during usual herpes. This is very important because healing takes more time. There also would be pains during a long-term healing, and they increase. If on a common skin there's tenderness in the area of rashes, then after an incorrect choosing of medications, such pains would be quite strong, even after clinical healing. So, PCR analysis of blood was taken for herpes zoster. After finding these herpes in analysis from the surface, antibodies were also found for all types of herpes zoster. Immunoglobulins A, M and G were positive, which indicates a reactivation of old herpes zoster and not a fresh infection. Positive PCR analysis of blood for herpes zoster were found. So, a classic therapy was prescribed. It included immune medications and a classic antiviral treatment of herpes. As a result of that, in 10 days' time, clinical healing came. That was confirmed by external PCR scrapings for the above-mentioned virus. Due to the fact that correct type of herpes was diagnosed and dosage was chosen correctly, then the following pains that are quite often observed were almost not noted in this patient in 2 weeks' time after healing. This indicates that clinical diagnostics, even during such an expanded clinical picture, as in this case, is not enough. You always have to do microbiologic diagnostics of virus that helps to correctly assess the character of lesion in a particular patient. If it is necessary to diagnose and treat any rashes in the area of sexual organs, you can consult venerologists, urologists and gynecologists of our paid medical center of dermatovenerologic dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such rashes. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.